Hey, so this week I was on the burn unit. Um, it was a really interesting experience for me. I got to participate in with a different nurse with changing dressings and staple removal. It was really intense. The floor in general, there's probably like half the patients were burn victims, and the other half were just um, regular med surge, like overflow. I had one patient that was in COVID recovery, and another that was just there for possible plastics surgery because they have an OR suite on the burn unit floor. So my patient this week was a 77-year-old male. He presented to the ER with burns on the anterior part of his right and his left leg, like all the way down the front, down to just about his ankles. Um, he he said that he was grilling, but he was inside his house. So they aren't really sure what caused it, but there was an extensive damage, fire damage to his house as well. He has a history of BPH and hypertension, and so they admitted him to the burn unit with 10 to 19% of his body surface with burns. So when I was able to talk to him, he had been there for a few days already. They were about to, or maybe a day. I'm not exactly sure, but he obviously was a moderate fall risk because of the burns. He really couldn't walk; like it was extremely painful for him to move his legs. So when I actually assessed him and spoke with him, he had already had a morphine injection. So, he told me, even though he's in pain, his pain at the moment was a zero. Like he said, he wasn't in any pain. He was getting ready. We were prepping him to go to the OR for his burns. So he is on several medications that were disease specific, but the something really specific. They give these burn patients what they call a burn shake, and that they give them twice a day. And then he was on some different medications for his hypertension and the BPH. They also had him on something because he's immobile. They had him on enoxaparin, I think is how you say it, for the prevention of DVTs, just because he's not mobile at the moment. Let's see. So, again, his past medical history, he has hypertension, high cholesterol. He also has had basal cell carcinoma and squamous cell carcinoma. Again, when I assessed him and spoke with him, he said that he was in good spirits. Well, he didn't say that, but that's like he was a very pleasant person to talk to. He didn't seem in any pain, wasn't in any distress while I was in there with him. His temperature was normal, 98.2. Heart rate was 91. That was on the monitor. His blood pressure was 142/68, but according to my nurse, that's kind of where his normal is. I mean, he has hypertension, but that's just where it wasn't abnormal at that moment for him. His respiratory rate was 15 and 95% oxygen saturation on room air. He is not a diabetic, so they didn't take his glucose or take his blood sugar. So he was alert and oriented times 4. He knew where he was. He was, even with the morphine injection, he was well aware of where he was, why he was there, what had happened. He normal GI, so bowel movement the prior evening, and he was having regular output of urine, which was good considering he's a burn victim. So obviously for skin, he has burns on the lower anterior portion of his extremities. In terms of mobility and his musculoskeletal system, there was no trying to apply pressure on his lower limbs, so I would probably say a 0 out of 5 on his lower extremities, but he was able to move his arm, squeeze, so 5 out of 5 on his upper. And then he had a peripheral IV on his left top hand, 18 gauge. And again, his assessment for pain was a 0 out of 10. This was right before surgery, so that's exactly where they wanted him to be. So he went into the OR. I believe it was, let's see, I wrote it down somewhere. He went in, he was taken for surgery at 0800. So again, that was burns 10 to 19% of his body surface, so they needed to take him in. They weren't exactly sure what they were going to need to do, but once they got him back there, they realized that the burns were not as significant as they originally thought, so they didn't need to actually do any kind of skin graft. With him, they just wrapped his legs with what they call a Mepilex, which is like a silver impregnated wrap that helps with the healing, and it also helps prevent, I think it's an antimicrobial that helps prevent infection. So it's like a silver dressing, and they wrap it and they keep it there for a while, and then they'll unwrap and then rewrap to promote healing. I think every day, like once a day, they do that. So, all of his lab values were normal. Let's see. So my nursing diagnosis for this patient was a risk for infection related to the burns on his right and left anterior legs, referenced by the destruction of his skin barrier, obviously due to the burn. Short-term planning would be to keep his pain level below a 3 on a 0 to 10 pain scale, and then ensure that we have active wound healing with no visual infections present, no purulent exudate, just making sure that there's no infection there. And then obviously interventions would be to apply the nitrate dressing as needed, make sure that we're examining the wound and documenting any changes from the prior, if there's anything, any changes for the bad, like smell, look, size, that kind of thing. And then just monitor his vital signs for fever. Make sure that there's no infection brewing. And then obviously emphasize, good hand washing skills and aseptic technique when he cares for his wound, and then when we care for it as well. And then just maybe increase foods that help with healing, like protein and different vitamins. And then I would just say that for discharge planning, teaching the patient, educating that patient how to, because he's going to be able to eventually do it on his own. Like I think in the beginning, they're going to send him, it would be more of a planning for going into an outpatient clinic and having them change his wound dressing, but eventually he's going to need to be able to do that on his own as well. And just showing him how to do it using aseptic technique. And that is it for me this week. Thank you.